Here's a disease that appears to be fallen into this basket of orphan diseases that people tend not to focus on. And we felt we had the means here at the Medical Center to be able to take a little bit of extra time and focus on this disease and be able to help people, certainly in Nebraska and in the region, who have this, give them a place where there's knowledge and the ability to offer them a wide range of treatments without having to travel to East or West Coast or down some of the major medical centers in the South. So we thought there was a need locally, and we felt that we had the means to be able to address that need, and that stimulated us to start this neuroendocrine tumor Carcinoid Clinic. It's grown dramatically. I mean, we've been doing it for nearly 4 years now. Our number of referrals have increased. These patients live for a long time. It's a disease that, while we can never get away or escape the fact that this remains a cancer, these are patients that, if they're treated appropriately, can live a very long time. So we have accumulated a number of patients, and we continue to follow those patients on a semi-annual, annual basis, depending on the stage of their disease and the treatments that are required. So it's not as if a patient comes in, has a treatment, the survival rate is poor, as in a lot of cancers today. These patients live for a very long time. So we're able to follow these patients out many years now after first seeing them 3 or 4 years ago. Carcinoid falls under a group of tumors called neuroendocrine tumors. They arise from what we know as neuroendocrine cells that can occur in multiple organs. It can occur in the skin, in the bowel, in the pancreas, in the stomach, in the colon, the rectum. It can occur all over the body. And so carcinoid really refers to those tumors that occur in the intestine, the stomach, the small bowel, and the colon. But they occur in the lung, they occur in the pancreas, and so it's a multi-system disease, and it can affect anywhere in the body. These tumors are slow growing, they tend to spread. Sometimes patients have manifestations of hormone secretion. As we said, it's a cell of endocrine origin, so some of these cells secrete hormones, and that's how the patient presents, not so much due to the size or bulk of tumor, but because of what this tumor is doing in terms of secreting hormones. And that's where the term carcinoid syndrome develops. Excess of hormone is secreted by the tumor, and it's that excess of hormone circulating around the body that results in the symptoms that the patients have of flushing, diarrhea, chest pain, anxiousness, and that's often how these patients do present. But not all tumors do that. Some of them don't secrete hormone at all, and the patients present with intestinal obstruction or large bulk of tumor within the liver. So it's a very protein manifestation of this tumor, and because it's uncommon, people don't think about it when patients first present, and a lot of patients have symptoms for a very long time before a diagnosis is made. Something we call a staged hepatic resection. It was first described by a group of French surgeons for colon cancer. That group in Paris applied the same thing to these neuroendocrine tumor patients with very satisfying results. And this relies on the innate capability of the liver to be able to regenerate. So what we do is take out the primary tumor, which is in the intestine, at the same time then take out tumor from one side of the liver, the side of the liver that we envisage as being the future remnant that's going to be left behind. And so that all happens at the first operation. We then stimulate the liver, that left side of the liver, to grow. We do this by ligating or blocking one of the portal veins, and that allows that half of the liver to grow and become bigger. Once that has occurred, we then go back in and remove the other side of the liver that has the remaining tumors. And so by doing that, rid her liver of all the tumor that's in her liver, as well as taking care of the primary. So it's a fairly cool procedure, but again, very demanding on patients to have to undergo multiple major hepatic surgeries is a big deal. That's where the Carcinoid neuroendocrine tumor program grew out of our expertise in liver transplantation and liver surgery, to be able to give us the ability to do these very big, very invasive procedures. Again, the support and everything around here we're well placed to be able to provide this kind of expertise. It's that trust that patients put in you that really makes this very, very satisfying.